Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. Thank you for joining us. Don't touch that dial. We have a great show today. Our guest is Dr. Christian Vale. Yes, his name is Christian, and he's a Christian, and he's here to open up a new branch of the Foot and Ankle Clinic in Monroe, Louisiana. The address is 3601 Desert Street, and it's a brand new practice. He's going to be sharing everything and anything about podiatry. He's a surgical residency trained podiatry specialist. He's going to be sharing his history of how his parents were born in El Salvador and they moved to America and he pursued the American dream. He went to Penn State, got his degree in exercise science, then went on to the university in Cleveland to get his diploma, his degree in podiatry medicine, and afterwards he went to Long Island Jewish to do his surgical training. He's extremely well trained. He's going to be a blessing to you. Don't miss this program. It's a blessing. Look forward to seeing you. Jesus is Lord. Hi, this is Dr. Toby, Health and Wellness, your host here, all the way from Mississippi, University of Mississippi, family physician, telling you you need to stay on top of this show because this is a show that we've got your foot in the door. Literally, your foot is in the door with this show. We're giving your foot the edge with this show. We have on the show with us Dr. Christian Vale. Dr. Christian Vale is a board certified, well, he's a podiatrist. He's trained at Long Island Jewish Northwell Hospital. He's trained at Kent State Hospital, trained in podiatry in Cleveland, Ohio. He went to Penn State University, and he's here with us in Monroe, Louisiana, as a new podiatrist as part of the Foot and Ankle Clinic, 3601 Desert Street, Monroe, Louisiana. You don't want to miss our talk. He's talked to us for 3 sessions, educated us tremendously on foot and ankle problems. He has some upcoming credentialing coming up, and I know you would like to know what he's doing. I didn't ask you about the board certification, but is that also something you're...
No, absolutely. So
Okay.
currently I'm actually board qualified.
Right.
Yes,
So
and so it's a
eligible
process.
to take the board.
Exactly.
Right,
It's
right.
a process to get that
So
board
I mean,
certification.
this is a gem in our city. We're so happy to have him, and we know he's bringing his skills, his qualities, his charisma, his character, his reputation. There's so much he's bringing on the table to help us in the northeastern part of Louisiana to take better care of our feet. But I feel that we can even do more than that. I feel that there are people watching who can learn from you and become future podiatrists.
Yeah.
You said that there are less than 18,000
18,000 in the entire
in
country.
the country, and who knows if the young man, young girl watching me can become the next podiatrist from the state of Louisiana. So I want you to tell us a bit about what it takes to get into, what are the prerequisites? So you're in high school and you're thinking 4 or 5 years down the line,
Yeah, absolutely.
what are my majors? What should I be thinking of in college
Yeah.
if I'm interested in going into podiatry
Yeah.
school down the road?
Yeah, absolutely. So we kind of touch base about the kind of the parallels that come with podiatry school and with MD school and DO school as well. And you know, it does kind of start out just like kind of you touch base on is in undergrad, and you need to start with having an idea that you want to do medicine, obviously. And in undergrad, you have to take your MCATs, and you have to have a pre-med degree. But it doesn't necessarily have to be pre-med specifically. You can have pre-med as a minor nowadays. But you can major in just about any other degree as long as you have your pre-med prerequisites that are usually, you know, your science, so your biology, your chemistry, your organic chemistry, you know, the calculus, so some mathematics, obviously, in addition to that. And like I said, you have to take the MCATs as well.
Okay. So you've got to get your sciences in.
Correct.
Okay.
Yes.
You're not going to get into podiatry school without at least biology, physics,
Correct.
chemistry.
Exactly.
Okay.
Exactly. So then, you know, you take your MCATs, and then you apply to podiatry school. And like we talked about, there's only 9 of them. So then you apply to them, and the prerequisites is an MCAT score. Each school has a different MCAT score that it requires, as well as a GPA. they have a GPA requirement as well. And then podiatry school kind of jump starts everything afterwards towards that. It happens very quickly. Undergrad comes through 4 years, podiatry school 4 years, and then afterwards we talked about kind of your residency and what you want to do with your residency, where you want to go, and what you want to specialize in the foot in essence of in your residency.
If let me throw it out this way: are there, because we have physician assistants, we have nurse practitioners, are there podiatry assistants?
So
are there podiatric nurse practitioners? I'm just
yeah,
throwing it out there.
No, absolutely. So we actually have a nurse practitioner that works in our office.
Oh.
And she's actually specialized in wound care, and so she's an excellent addition to our practice because she does a fabulous job with wound care. But yeah, there's nurse practitioners. There's not necessarily, you can't specialize in podiatry nurse practitioner.
Oh,
but you could be
assistant.
exactly.
Okay.
But you could do a nurse practitioner and then do a field. Best example, exactly. So wound care is related to podiatry, so it's a beneficial aspect to the office.
Give me an idea of those who work in your office. Are they mostly medical assistants? Are they mostly, what's their background?
Yeah, so many of them are medical assistants.
Okay.
Many of them are medical assistants, but every one of them have some kind of medical background, whether it's they started for an associate's degree for nursing school or for nursing. But most of them are all MAs. We do, like I said, we have a nurse practitioner, and then we do have the 3 doctors.
And if somebody wants to, work in a podiatrist office, I'm just saying for the people watching me now, give me an example. What do those office staff do? Blood pressure, weights? Do they do anything other than the regular medical assistant that they will do in my office, for example?
So our MAs are amazing. I can't say enough great things about our MAs because they honestly, it feels like I have residents with me. They go into the room, they do the blood pressure, they do the vitals, but then they kind of start the workup as well for me.
Okay.
So when they come into the room and they kind of present the patient, it's kind of like an attending physician or an attending and a resident kind of relationship, And the great thing about working in podiatry, is you work up these patients, you kind of get kind of a repertoire and kind of like spiels that go with them, and so these MAs are great at being like, oh yeah, they do have a high arch foot and these hammer toes.
Right.
This is something we might think about doing, especially me coming in. It's great to have these MAs exactly that are experienced that say, oh, we've tried doing this, or this is an option. So, these RMAs are phenomenal, really are.
Interesting question I wanted to bring up. What ages do you see?
So we see pediatrics to geriatrics, basically. So they're all age groups we see. And I like to think that because I had a very good training in pediatrics in New York City, that I do very well with pediatrics as well. And I definitely want to keep working with pediatrics as well.
How about age? Not a limit. There's no limit.
No limit.
Sex? There's not a limit.
No limit.
Okay.
There's been...
Weight?
Nothing.
You're not worried about 300, 400, 500 pounds? Oh.
No. And that's kind of the glory of podiatry is that you can see... You don't know what's going to walk through that door.
Oh, really?
You really don't until you go in there and you get the patient statistics. I mean, you have no idea.
Yeah, it's phenomenal. All right. Tell me a little bit about the opportunities you see in the Monroe podiatry market. Yeah. What are the opportunities that you, since you've been here, think you can make a difference with?
No, absolutely. I mean, there's already great established podiatrists here in the area already. And I think that, me coming in and working with Dr. Hunter, who is very well established in this community, and this amazing office that he had put together, the largest like I said, in the state of Louisiana, it definitely brings in an opportunity to increase the patients that we can see in the office, compared to maybe a smaller office where patients have to wait a little bit longer. We can have them in this facility and see more patients more readily. But also, it gives a great opportunity to provide more. So, there's different things that we want to do with this new office that, potentially all they would do would benefit the community.
Right.
So we have the space to potentially do more with this office to provide better options and availability for different things that we can do. But in general, I I look forward to working in a community like this. It's very close knit. Still provides an immense amount of pathology and diversity in pathology, and a good patient amount that I still can contribute to the community.
Wow.
Even though, New York City, there is, a podiatrist pretty much every 5 minutes, every
Oh,
5 blocks, there was a
really?
podiatrist in New
Oh.
York. Here there's not that many. I mean, we talked about there's maybe 4 or 5 in this area, but it's a great opportunity just to be in an area like this and still get diversity in pathology and still be able to work with patients and provide the training that I had from, Pennsylvania, Ohio, New York, and bring it down here and give patients another podiatrist that can provide something else for them.
Right. Tell us a bit about what it took for you to get credentialed with the medical board in Louisiana. Was it difficult because you came from out of state?
Yes.
Was it
so
a
it was
tough-
it took a lot longer and it was a little bit tougher. So every state has their own requirements and their credentialing for becoming a license or having a license, and as well as each state have their own requirements on what a podiatrist can actually even do, and that's dependent on the governing body, so the medical board of examiners here in Louisiana. It's a little bit easier if you have a residency here. If you did your residency here in Louisiana, like Dr. Hunter did, he did his down in New Orleans.
Oh, New Orleans.
In New Orleans. It's easier to get a state license. For me, it just took a little bit more process. I had to provide a lot more information, so my residency, my case logs, my obviously my diploma to show that I graduated. So it took a little bit longer to actually come into the area and get a license. But Louisiana itself is a phenomenal state to work in as a podiatrist.
So you finished in February, residency.
So I finished in June.
Okay, so you didn't wait too long. I mean,
No.
this is August
No.
1st.
No.
That's
So
not long.
the
I waited 2 months, so.
Yeah. Well, the process started in like March, and I
Oh.
didn't actually get my license for Louisiana until maybe the end of June.
Okay.
So but with COVID, there was a little bit
Right,
of stuff going on, so
right,
it took a
right.
little bit longer. But no, I mean, as soon as I got that license, it was pretty much
So the Louisiana State Medical Board of Licensure
correct.
is the board.
Yeah,
Okay.
I think Louisiana State Board of Medical Examiners. They're
Is
the
it
ones
an
that grant it.
annual renewal? Is it how? Because I do mine every year
Mhm.
with the Louisiana State Board. Do you have to renew yours every year?
Correct.
Okay.
Yes.
Do you have to show CMEs and?
Absolutely. So
Okay.
just like we need CMEs to keep our board qualification and board certification, you also need it to keep your state license as well. Absolutely. But podiatry, it's great because there's an overlap with orthopedics. And so you can do your CME with orthopedics at different conferences, and there's tons all over the country that you can continue to learn and be able to provide something new.
There's a very big orthopedic group here, the
Correct.
Northeast Louisiana. So I think they're pretty nice. They're pretty well organized.
Yeah, absolutely.
So
Absolutely.
I haven't been there recently, but I know a few people there.
Yeah.
Tell us a bit about privileges. So when I apply to a hospital, they want to know what procedures I'm going to be doing.
Yeah, absolutely.
They don't want me to do a C-section because they don't think I can because I'm not an obstetrician.
Of course.
So in your respect, when you apply to Ochsner and Glenwood, I
Uh-huh.
don't know if you've done it already, what procedures are you going to, and you can demonstrate those
Yeah.
with your
Absolutely.
With your foot
So as far as
model,
procedures that
yeah.
I'll be able to do, because of my training, the state of Louisiana, and also being a very podiatry-friendly state, I pretty much can do anything from the front of the foot to pretty much the level of this ankle here. So that includes hammer toes, bunions, any kind of fractures of the midfoot, or like we talked about, a flat foot condition. Different procedures I can do in the middle of the foot, in the ankle area. I can as well do procedures in the ankle, ankle fractures, ankle fusions. Pretty much, I'm going to be able to do surgery, and I can do surgery, the entire aspect of the foot and the ankle. So,
Okay.
and those are going to be my privileges as well, to do anything from the foot
all
into
the way
ankle.
to the
ankle.
hind foot. you
Exactly,
call
the
it.
hind foot, and then, like I said, the lower extremity, the lower leg.
ankle.
Exactly.
Wow. Okay. What do you tell patients who have, oh, I want to get out and run, and I mean, do you give them? Because I've seen a lot of patients who come in with hairline fractures because they haven't walked for months and years, and then they suddenly start running 10 miles. I
Yeah.
mean, I mean, what would you advise a patient? How would you tell a patient, okay, the kind of Snickers to buy, the amount of time they should spend
Yeah.
walking,
Yeah.
how much intensity?
Yeah.
I don't know if that's part of your purview, but what do
Yeah,
you?
absolutely.
Mhm.
I mean those weekend warriors per se, the ones that
Yeah,
like, oh,
yeah.
I just get up in the weekend and I want to go for a run, and they injure themselves. I mean, the big thing is, when you come and see a podiatrist and or a foot and ankle specialist, we take X-rays and we evaluate your foot biomechanically. We look at how your foot shape is and how the tendons are pulling, how the ligaments feel, in order to better give you advice on the proper shoe gear or orthotics, or if stretching regime or anything that we could do to get you on your feet and have healthy feet and have functional feet. I tell my patients every single day, I want you to have a more functional life after you leave this room. I want you to have a healthier, functional life. I want you to be able to do what you love and enjoy. If all it is me trimming up the callus or an ingrown toenail, at least you have a more functional life after you don't have that injury or that nail injury as well.
Wow. Tell me a bit about, you mentioned this in the earlier talk, vitamin D. Does that affect a patient's bone viability in your from your knowledge and
Yeah,
training?
absolutely. So there's actually some school of thoughts that suggest having a patient supplement vitamin D and calcium before a surgery. So if
Okay.
they're having a surgery that's being done on any of the bony areas, some actually suggest supplementing vitamin D and calcium in the preoperative, so before the surgery, and then afterwards, in order to continue this healthy bone growth. But even outside of a surgical aspect, it's absolutely important. I mean, in this country, there's a epidemic of vitamin D deficiency, and the health benefits that vitamin D brings is
Right.
obviously crucial.
Because a lot of us are indoors all the time.
Absolutely.
Yeah.
So vitamin D, I mean, it's something that you can get over the counter and start supplementing. It's not necessarily you need a doctor's prescription or anything to actually do.
Just a few more questions about the demographics of podiatry. What percentage are, you said 30% were females,
Yes.
70% were male.
Correct.
We don't know the Hispanic, African American, Caucasian demographic.
Well, I can say as far as the Hispanic population, it's very, very small.
Like
I-
5%.
Oh, if not smaller, correct.
Wow.
I know that me graduating from podiatry school and becoming a podiatrist and a podiatric surgeon, I'm part of a very, very small percentage of Hispanics in the population that are podiatrists.
Oh, wow.
And it's something that's growing, and that's why it's kind of good being a small profession, because then we can kind of rally diversity, not only in diversity in the sense of ethnicity, but also in gender. So you talked about the female gender being a diverse group in podiatry. It's a great opportunity to rally that and bring fresh or anything new to the field, and just continue to become diverse as much as this country is diverse.
And I'm sure you found out that most podiatrists stay in the metropolitan city areas. I'll easily say 70% mostly
Correct.
stay in those parts.
Absolutely.
Okay.
Yeah, and
Is it because of they earn more, or is just better patient?
it's actually not necessarily because they earn more. There are actually some studies that show that being a podiatrist in a smaller town, you actually can generate higher income. But the reason why they stay in an area like that is because there's major hospital systems in that area.
Oh,
So they can work for these major hospital systems that have different kind of benefits that working in a smaller town wouldn't be able to offer. Plus, you're pretty much guaranteed a population. When you work in a major
Right.
city, this
Somebody's
in
gonna
this
come
surrounding
in.
area, this is my population. And when you work in a smaller town area, you get a population, but you also need to work on spreading out. So, one of my big things when I first came down here is I drove all around this area, all the
Went
way
to
from.
Poverty Point.
I went to, yeah.
They said that's they say it is the poorest part of the United States. I don't know if it's true, but they call it Poverty Point
Yeah.
for a reason.
Yeah. So I drove all around this area to introduce myself to any doctor that would
Oh,
that would
really?
talk to me, and just
Okay.
introduce myself
Awesome.
and say, I'm down in Monroe, West Monroe, and I know it's a little far from you guys, but if I'm here to help.
Awesome.
Yeah,
Okay.
absolutely.
What's the national association? Like we have the AMA, American Medical Association. What do podiatrists have?
So we have the ABFAS, which is the American Board of Foot and Ankle Surgery, and then we also have the American Board of Podiatric Medicine. And so those are actually two different board qualification and certification realms. Some podiatrists carry both certifications, but it's not necessary. You can choose one or the other. In some states, you don't even need necessarily a board certification or a board qualification. It really comes down to your training. For me, I wanted the board certification, or more specifically, the surgical board certification. So I'm board qualified in the American Board of Foot and Ankle Surgery. And it's a process. You need to have a certain amount of surgery cases before you can have that certification. It's a very long process.
Oh, wow.
You have to have a certain number of surgical cases. You send it to, once a year they have an entire panel review all your surgeries that you performed in a certain period of time to determine whether your pre-op course was correct, your post-op course was correct, and if you did everything correctly, then you're granted your certification. But it's something you have to renew every about 10 years once you finally hit that certification.
Wow.
But it's something.
I'm shocked Georgia does not have a podiatric school. As big as Georgia
That's
is.
true.
Wow.
Yeah.
And easily we can say it's 70% possibly Caucasian, maybe 20, 30% African American. What do you think?
I
in
would say
terms
that
of
as
the
well.
numbers?
Yeah, I would say that as well.
Interesting. Oh, wow. Now, if you have a license in Louisiana, does that grant you practice privileges in Mississippi, Alabama?
No.
Or you have to now apply for another license?
I would have to apply for another license.
In those respective states?
Correct.
It
Yes.
might be easier because you have a Louisiana
Exactly.
license.
So because I have a license granted in an area that's closer to some of these nearby states, it potentially would. I haven't looked into it, but I'm sure actually getting licensed in one of those other states would be easier.
If you were to maintain your license, or after you pass the boards or take the boards, what would you need to do every year to maintain board certification or maintain licensure? I mean, what courses would you go to? You said you go to some orthopedic. Are there special podiatry only courses?
There are, but because orthopedics and podiatry overlap in a lot of aspects,
Right.
the specific podiatry courses, they're more, the wound care aspect of it as well. But, there's different companies that offer different courses. So if you want to work more on arthroscopy, so, ankle scopes, there's courses that you can go there, and several days you can practice on
So
it more.
hands-on.
Exactly.
Okay.
And those are part of your CME. So you have to have a certain amount of CME credits every year in order to keep your state licensure as well. So I believe I don't know the exact number, but there is, you do have to have a certain amount of CME to keep your state license.
So what would you say to that young boy, young girl watching who's interested in podiatry and doesn't see the possibility, the potential, because they think it's expensive, they think it's 10 years, they think it's, it's way beyond their possible ability to achieve. I mean, tell them a bit, what would you tell them if you were to speak to them?
No, absolutely. And the idea of being a foot doctor obviously doesn't appeal to a lot of people. But there are so many benefits, and I hope that anybody that has listened to us the past couple of sessions see how excited that a person can be about this. Because that's what I am. I'm very dedicated and very enthusiastic about what I do on a daily basis. And for anybody that that wants to have that wants to pursue medicine, that has a passion for medicine and biology, podiatry offers such immense amount of science as well. In the past couple of sessions, we've talked about biomechanics. It's not just, oh, here's the foot and that's a bunion. It's a problem-solving aspect of it too. And for somebody, it's enthusiastic about learning, because it is a continuing learning process that you have to do. Just because I've completed my surgical training doesn't mean that it's over and done with. I'm learning on a daily basis. I still have to continue learning on a daily basis.
Wow.
But no, absolutely. It's a long time. It's dedication. You have to be dedicated to it. because it's several years of your life that you're giving up in
But
essence.
it's worth it.
But it's absolutely worth it. It's
Wow.
absolutely worth it. I mean, I have a beautiful wife and a beautiful daughter, and I'm happy, and I
Wow.
enjoy what I do on a daily basis.
That's very. And I'll just throw in here, Jesus also approved podiatrists. Why? Because he washed his disciples' feet.
Correct.
I mean, he told Peter. Peter said, "Don't wash my feet." Jesus said, "If I don't wash your feet, you can't have any part of me." I think that's an approval of feet, of the foot.
Absolutely.
So Peter said, "Oh, wash everything, head to toe." Jesus said, "If I take care of your feet, that's good enough." So I'm throwing out something here for podiatrists. I think Jesus himself approved of podiatrists because he said, "Peter, if I can take care of your feet, I can take care of your whole person." And I think Dr. Christian Vale has been such a blessing, such an example, and such an inspiration to those of us Hispanic background, Northeast trained, moved to Louisiana, making a practice out of a new practice in Monroe, Louisiana, serving the community with a genuineness, with a heartfelt dedication and devotion. I'm so glad he's part of our community, and I'm so glad that he's available to take care of your foot needs. Please, I said earlier, his address is Ankle and Foot Clinic, 3601 Desert Street. It's on the screen. The phone number is on the screen. Please give him a call. If you have any condition that requires seeing a podiatrist, diabetes, poor circulation, maybe even arthritis, gout, so many things, plantar fasciitis, flat feet, high arched feet. If you have any foot problems, ankle issues, you need to see Dr. Christian Vale. He will treat you with respect. He will treat you with compassion. He will treat you with dignity. He will treat you with love. I'm recommending him highly, not just because my office was close to his, but he's a terrific individual, and I highly recommend you go out and see him. Also, I want to invite you for our next Holy Ghost night coming up on August 28th. It's the last Friday of the month. Don't forget, we meet every month at the Clarion Inn. It's 11 p.m. We have a special guest, Cody Ernest. He just moved from Houston down to he's back with his parents here, and he's going to be ministering to us. We're calling the theme Called to Inherit the Blessing. Called to Inherit the Blessing. From 1 Peter chapter 3, verse 9, we are believing God for an outpouring. You can't afford to miss your inheritance. There's an inheritance Jesus died to give you. That's why you're an heir and a joint heir with Christ. Don't die without your inheritance. Don't miss out on the blessings that Jesus died to give you. Don't let COVID, don't let the negativity around you stop you from becoming who God called you to be. That's why Dr. Vale and myself are here, because we know God helped us to become who we are. So join us, 28th August. It's going to be at the Clarion Inn, now called Oyo Hotel, 1051 on I-165. And it's going to be 11 p.m. to 4 a.m. Looking forward to seeing you. Don't forget, write to us, P.O. Box 550. Jesus is Lord. God bless you.